Now, today is World Stroke Day, and according to the Angels Initiative, stroke is the fourth biggest natural cause of death in South Africa, where every day 360 people get a stroke, and out of those, 110 people die, and 90 are left with life-changing disability. For more on this, I'm now joined by Carica Combrink from the Angels Initiative Project. Carica, thanks very much for joining us, and welcome to the program.
Thank you, Peter.
Oh, I've got to tell you, those statistics are quite scary, and I don't think we pay much attention to this. You know, we hear about other diseases and issues, but stroke. So the first thing, I guess, is what is a stroke?
So, Peter, there's actually a couple of different kinds of stroke that a patient can suffer, but the most important message to get out there pre-hospitally is when you suffer any of these symptoms, irrespective of if it's one of these 2 or 3 strokes, you need to get to a hospital very urgently. But getting back to your question is there's different kinds of stroke. The majority of strokes being an ischemic stroke, which means that there's a clot that's blocking one of the vessels in the brain. And that means that there's no blood flow, no blood supply to a portion of the brain. And that basically means that some of the cells will die. And that will give you the disability that you normally see with a stroke patient. The other one that's not as prone in, around the world, a little bit more prone in South Africa, is the hemorrhagic stroke. So that is where a vessel bursts and there's immediate blood into the brain and into the cells of the brain, where the cells will then immediately die off.
All right, so how do we recognize that maybe I've got a stroke coming on, or that you see somebody is about to have a stroke?
For these patients, time is of the essence. So the scary statistic around the world is that every minute that after a patient has suffered a stroke, there's about 2 million neurons or 2 million brain cells that dies. So that is the difference between someone being able to pick up their arm versus not picking up their arm. So there's a very easy acronym that's being used internationally as well as in South Africa, and we as the Angels Initiative, as well as all of our partners, stick to this acronym when we do any type of public awareness. So the acronym is FAST. So F is for your face. If the patient smiles and there's one side that's drooping down, then you can immediately suspect a stroke. The A is for your arms. So if the patient picks up both of its arms and one drifts down, or they're unable to pick it up in the first place, that is also considered a stroke. And then S is for your speech. So if the patient's struggling to talk back to you, or if you can see that they can't understand you, then there's also something wrong with the patient, and it might be a stroke. And then T is so important to get to the hospital. T stands for time, because there is a certain time window to actually treat these patients before there's permanent damage.
All right, so FAST is the acronym, and once we see any of these, don't hesitate, get them to the hospital as quickly as you can. Is there anything that you do in between the time that you see these symptoms and you get to the hospital, or you just go to the hospital? Just
get there as soon as possible, and also get to the accurate hospital with the minimum requirements. So what's really important is it needs to be a hospital with an emergency department and also a radiology department, so that they can do the preliminary testing to confirm if it is a stroke or not.
So what are the risk factors? What is it that makes one person more prone to stroke than another?
Of course, Peter, there's modifiable and non-modifiable. Your modifiable is, of course, healthy living will decrease your chances of having a stroke. Not having so much stress, it's easier said than done. Not having too excessive alcohol abuse. Smoking is a very big one. If you stop smoking, then your risk immediately drops. Smoking increases your chances by 6 times, so that is a massive one. And then, of course, the hypertension or your high blood pressure, your atrial fibrillation, which is irregular heartbeats, diabetes. So all of this needs to be checked by your general practitioner on a regular basis, so that you can get preventative medication to reduce your risk. And then, of course, non-modifiable is with increased age, gender. Females are more prone to stroke versus males. So all of this, unfortunately, we cannot do anything about.
South Africa is particularly problematic. Why is that?
Well, as we've had the discussion a little bit earlier as well, I think because we have such a poor community as well, and such a big geographical split of people really staying in remote areas, not having access to clinics on a regular basis and on an easy access basis, they are walking around with these time bombs. They're walking around with high blood pressure, they're walking around with the cholesterol, etc., without being diagnosed and without having the medication. And then one day they will suffer these symptoms, and it will be too late for them.
So what are you trying to do as the Angels Initiative?
So the Angels Initiative focus on a threefold project. The biggest portion of it is being public awareness, and we are so lucky in October being World Awareness Month and Stroke Day being today. We have a lot of opportunity to get the message out there, because we can get the facilities as ready as possible. If the patients don't realize that they're suffering a stroke in the initial phases, we can do nothing for them. So we're doing a lot of public awareness with the Heart and Stroke Foundation. We're also doing a lot of training with pre-hospital services, all the ambulance and paramedic guys, and then a lot of focus goes into in-hospitally optimizing the stroke treatment so that they can treat the patient as soon as possible when they get to the emergency department.
All right, we've run out of time, but I think once again, just give us the acronym, and also what must we stop doing to make sure we don't put ourselves on that risk profile?
So again, the FAST is, F is for your face. If your face droops, that is a sign of a stroke. A is for your arms, if one arm drifts down. S is for your speech. You can only have one of these and it might be indication of a stroke. And then T is for time, because time is so important in a stroke. And then, of course, like any other disease entity, exercise, a balanced life, stop smoking, don't drink too much. Weight, of course. Yes,
all those things that contribute.
Get to your doctor so that they can get you on the correct preventative medication for what risk factor you might have.
All right. Carica, thanks so much for joining us and making sure that we're aware of this problem area. Fourth largest contributor to people dying in South Africa. It's scary stuff. So you can do a lot to prevent and manage, and also FAST. That's the acronym that you need to remember, and get to the hospital as quickly as you can. Every second counts.